Welcome you to this short video about the tumor markers. Let's start with alpha-fetoprotein. Alpha-fetoprotein is the primary tumor marker which is increased in yolk sac tumor. Now the doubt is what is a yolk sac tumor and why is it also called as endodermal sinus tumor? Yolk sac tumor is that which will have this yolk sac. But since it will also be resembling an endodermal sinus, it is known as an endodermal sinus tumor. Now, how will an endodermal sinus be? A central blood vessel surrounded by a group of cells, then some space, and then by a group of cells. So this is how an endodermal sinus will look. So yes, something which we can resembling a glomeruli or something which will resemble the embryoblasts, the blastocele, something like that. We can visualize it in that way. So the endodermal sinus tumor and the yolk sac tumor we can visualize in that way. So in both of these, the alpha-fetoprotein will be increased because they both are in a that fetal stage, the precursor for that fetal stage, isn't it? So it is from where the fetus will originate. So alpha-fetoprotein is going to increase in endodermal sinus tumor as well as in yolk sac tumor. So this is the first point. That is alpha-fetoprotein will be released from the yolk sac tumor or the endodermal sinus tumor. Secondly, the alpha-fetoprotein can also be released from the mixed germ cell tumor along with hCG. So now the question is, what is a mixed germ cell tumor? The mixed germ cells as such can give rise to germ cells, that is the gametes. So that is known as the mixed germ cell tumor. So those primordial germ cells can give rise to the germ cells. So not only the germ cell, the primordial germ cells can form either a germ cell or they can form a placenta or they can give rise to many structures in the body like the cartilage, bones, anything. So from whichever organ they arise, say they are arising from the placenta component, then it will be producing the hCG. They are arising from the yolk sac component, then it will be releasing the alpha-fetoprotein. If they are arising from the mature components like cartilage, bones, then they will be forming the teratoma. So the mixed germ cell tumor arises from mixed germ cells, which is the precursor for the primordial germ cells. The primordial germ cells will form the gametes, and the primordial germ cells can even give rise to the placenta. It can even give rise to any of these structures which can form. So therefore, the alpha-fetoprotein as well as the beta hCG can arise from mixed germ cell tumors. Thirdly, the alpha-fetoprotein can also be produced by the hepatocellular carcinoma. Why? This is because in the fetal stage, the liver will be producing the alpha-fetoprotein. So, in the hepatocellular carcinoma and in certain hepatoadenomas, the liver will go back to its primitive form and therefore will start releasing the alpha-fetoprotein. So, therefore, the alpha-fetoprotein is also released by some hepatocellular carcinoma. So, there are 3 points to remember about alpha-fetoprotein. First one, alpha-feto, the fetus, so it is arising from the yolk sac tumor or endodermal sinus tumor. Secondly, alpha-fetoprotein along with the hCG can arise from mixed germ cell tumors which arises from the primordial germ cells which can give rise to either germ cells, either placenta or any structure for that matter. Thirdly, the alpha-fetoprotein can also be released by the certain hepatocellular carcinoma. This is the crux about alpha-fetoprotein. Let's see about alkaline phosphatase. Alkaline phosphatase is released by the placenta. This ALP, it is an isoform which is different from the one which is released by the bile duct and which is increased during bile duct obstruction. The alkaline phosphatase is released by the placenta. The alkaline phosphatase is increased in seminoma. Placental alkaline phosphatase is increased in seminoma. LDH is increased in dysgerminoma. So, what does the LDH indicate? Anything which is aggressive or the cells will be having more amount of LDH. So, that will be releasing more LDH. Dysgerminoma is aggressive form, it releases more LDH. So, when the term placental alkaline phosphatase, we should know that it arises from either seminoma or dysgerminoma. Cancer types. CA15-3. It is increased in breast cancer. CA19-9 is increased in pancreatic adenocarcinoma. Calcitonin is elevated in medullary carcinoma thyroid, and normally the normal calcitonin produced by the thyroid, its role is to inhibit the osteoclast and regulate calcium homeostasis. What about carcinoembryonic antigen? That is increased in colorectal cancer. The LDH, as we saw, it is increased in dysgerminoma and serves as a marker of cell turnover. hCG, it increases in choriocarcinoma. PSA, prostate specific antigen, is increased in prostate cancer. So with this, we have come to the end of the topic. All the best for your exams.